Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something that sounds scary in its name but is actually rare and, when caught early, very treatable: breast implant-associated ALCL. First, let's clear up the most important point. BIA-ALCL is not breast cancer. It's a type of lymphoma, which means it's a cancer of the immune system cells, not of the breast tissue itself. In this case, it can develop in the scar tissue and fluid that naturally forms around a breast implant, a layer doctors call the capsule. This condition is strongly linked to certain textured implants, the kind with a slightly rough or grainy surface, rather than the smooth round implants most commonly used today. Because of this link, some textured implants have been removed from the market in various countries over the past several years. If you have implants and you're not sure which type you have, that's a completely reasonable thing to ask your surgeon at your next visit. So how would someone know if something is wrong? The most common sign is a swelling around the implant that shows up well after the original surgery, often years later, sometimes 7 to 10 years or more. This swelling happens because fluid builds up between the implant and the capsule. Other possible signs include a lump near the implant, pain, or a noticeable change in the size or shape of one breast compared to the other. It's worth repeating, these changes typically show up long after the initial surgery, not right after, so this isn't something that happens suddenly in the days or weeks following implant placement. If a doctor suspects BIA-ALCL, the usual first step is to sample the fluid around the implant with a needle and send it for testing. This is a pretty straightforward outpatient procedure, and it gives a clear answer about what's going on. Now here's some genuinely reassuring news. Compared to many other cancers, BIA-ALCL is rare, and when it's found early, it is highly treatable. In most cases, treatment involves surgically removing the implant, along with the surrounding capsule of scar tissue. Because the disease usually stays contained within that capsule, removing it often takes care of the problem entirely. Additional treatments like chemotherapy or radiation are sometimes used, but usually only in more advanced or unusual cases, which are uncommon. It's also worth knowing that having breast implants does not appear to increase a person's overall risk of the more common types of breast cancer that develop in breast tissue. BIA-ALCL is a distinct and separate condition from those cancers. So what's the practical takeaway here? If you have breast implants, it's a good idea to know what type they are, textured or smooth, and to keep up with your regular follow-up appointments with your surgeon. You don't need to panic about this condition, but you should feel comfortable paying attention to your body. If you notice new swelling, a lump, ongoing pain, or a change in the shape or size of one breast that appears well after your surgery, that's worth bringing up with your doctor sooner rather than later. Most of the time, changes around implants have simple, benign explanations, but getting anything new checked out is always the safer path. Understanding your own implants and staying in touch with your care team are the best tools you have here, and they go a long way toward peace of mind. As always, this video is meant to help you understand the general picture, not to diagnose or treat anything specific to you. If you have concerns about your own implants or any symptoms you're noticing, please talk with your doctor, who can look at your individual history and guide you properly. Thanks for watching, and take care of yourself.